Good morning, everyone, for joining us. This is NAMI Iowa's first ever virtual day on the Hill. I don't know if we want to say it's our first and our last, because maybe we shouldn't put that on ourselves right now. But this is the first time we have done this virtually, and I will say that in some ways it may be easier to do it virtually. If you're a first-time advocate and you haven't been to the Capitol before, it's kind of a place that has special rules and can sometimes be a little hard to get to. So we don't have to worry about that this year. We're going to be doing things virtually. I should stop and introduce myself. My name is Mary Neubauer, and I'm a member of the NAMI Iowa board. I'm a mental health advocate from Clive, and I head up NAMI's advocacy committee. And that's everything that we're going to be talking about here today is advocacy, making our voices heard, and making sure that the folks who are in charge of passing laws on behalf of all of us citizens understand what's important to us. So I really want to thank everyone for being here today. We had more than 200 folks registered for this virtual day on the Hill. I think the last number, I know, definitely clapping. I think the last number I saw yesterday was 217. Most importantly, all of you on this call represent 46 of Iowa's 50 Senate districts and 70 of the 100 House districts. I know, again, that's huge in terms of making sure that lawmakers understand what NAMI thinks is important and getting that message out there. I'm going to go through just a few housekeeping items here today, and then I'm going to turn things over to Peggy, our fabulous executive director. But just for everybody who's looking for information, please remember NAMIiowa.org, and that's NAMIIOWA.org. That is the website for NAMI. You can find all of the information on there about today's virtual Day on the Hill. If you go to the website, to the homepage, along the left-hand column with the links there, just click on the 2021 Day on the Hill link and you'll find all of the information there. There are documents, our legislative priorities, the agenda, the talking points for today. There's also the super easy way that you can find your local legislators. If you don't know who they are, there's just a one-stop shop where you put in your address and it tells you exactly who your representatives are. How to engage in the sessions as we're going along. If you have questions, please put them in the Q&A submission box. And then Nina with the NAMI staff is going to read those questions aloud to the presenters at the end of each session. We're going to try to do a recap at the end of each session just to keep things flowing smoothly today. But as we're going along, please use the chat box just to share your observations and ideas with other advocates. We would love to hear from you, to know that you are there. We are recording all of today's sessions, and a YouTube link will be added to the webpage this afternoon so that if you missed a particular session and want to go back and look at it, you'll have the opportunity to do that. If you are looking for help, maybe hearing things today, or understanding what's being said on the screen, live captioning is available, and you can turn that on using the taskbar at the bottom of your screen today. Please fill out an evaluation form, and that can be found on the webpage that I referenced earlier. At the end of today's session, we really want to help improve Day on the Hill for the future. We're always looking for ways to make improvements and make this day more relevant. And then also please fill out a legislator contact form for each lawmaker you connect with. We want to hear, what was discussed, what their reaction was, any observations or questions they may have. That helps NAMI and its lobbying team as we move forward from here, trying to make sure that we achieve the goals for the organization. So we're really excited for everybody to be here today. As I said, in some ways, I think doing things virtually makes today easier in terms of just getting around and maybe not having to run around so much as we normally would be. But I will say that it makes the process of contacting lawmakers that much more important, because we need lawmakers to know that NAMI advocates are engaged and care about issues And those issues are important to us so that they will therefore be important to our elected representatives. So I am going to turn things over to Peggy Huppert, NAMI's Executive Director, and she can share a few more details with you this morning. Thank you again, everybody, for being here.
Well, thank you, Mary. Mary is our wonderful advocacy chair. She's also the secretary of our board, and she is an incredible advocate. So thank you. I'm Peggy Huppert. I'm the executive director for NAMI Iowa. We're really happy to have all of you here today. We're up to 92, so that's fantastic. As Mary said, we had over 200 people register for today. So I know we'll be having more people join us as we go along in the day. And the entire session is recorded, as Mary said. So we're hoping that even more people will watch it later, which is another great advantage of doing it virtually. And as usual, it's not a very good weather day for NAMI Day on the Hill. That's kind of our MO. We've had lots of cold rain and mixed in with snow. It's very rarely a nice day. So par for the course, it's not a great weather day. So you all have saved yourselves driving to Des Moines in not so great weather and traipsing up to the Capitol in not so great weather. But it is still really important that we engage and talk to our legislators. So my job is to do a brief overview of our priorities. And as Mary said, you're going to find a lot of information, resources on our website about today, probably more than you'd ever want or need. But we do have a document called Talking Points. And we took our top 4 legislative issues and broke out some bullet points for you because we thought that would be helpful. In the past, when we go up to the Capitol, we've had something called a palm card, which you literally could hold in the palm of your hand, which made it very challenging to get information on that small size of a document. We had a little bit more space this time since we're doing it virtually. But we also didn't want to put too much. So we have 3 to 4 bullet points per issue. And we hope that by laying it out this way, it's helpful to you. Feel free to copy and paste any of this into an email or follow it if you're talking on the phone with your legislator. Use it however it works best for you. And I want to preface this by saying, if there's something you still don't understand, you want to learn more about, it's unclear to you, let us know. Put it in the chat box, raise it. If it occurs to you later, send us an email and we can clear it up. And also, if you get questions or concerns from legislators that you can't answer, we want to know about that. So that's why it's important to complete those forms. Because we do look at them and we can help you, or we can get back to the legislator directly. Because every single day on the Hill, there are questions and concerns that are raised by legislators that advocates can't answer. So we don't expect you to have all the answers. These are complex issues. They're not easy. They're not black and white. Although we have put some black and white down, they're not easy. So the first one is a sustainable source of funding for our mental health system. We've been working on this for really pretty much ever since I've been with NAMI, which is 5 years, but really very in a focused way for the last 3 years. And the problem, as many of you know, is that the mental health system in Iowa is primarily funded through the property tax, mental health property tax levy. It's been frozen at 1996 levels. Many of the 14 regions are in various ways at their caps for these levies. But at the same time, over the past 3 years, the legislature has passed 2 major policy bills, complex needs and the children's system, and put 27 new requirements on the regions to implement. But their funding source has not changed. So that's a problem, especially for large growing counties or areas like Polk. So Polk has run a deficit ever since it was created, and they've had to try to fill that in different ways. So there's no bill to reference on this one, but what we're saying is ask your legislators to support state funding for mental health services in the next budget. The governor has recommended $15 million. That's a good start. And we need to keep moving forward with it. And we'll be talking more about that in a session with Renee. The second issue is telehealth. And that is a very live issue right now. A bill to require private insurers to continue to reimburse virtual visits, behavioral health only. It's what it's narrowed down to now. Passed the House with only 1 no vote last Monday. It's now in the Senate where it faces an uncertain future. And that is a really important bill for a lot of people. And we're going to be talking more about that as well. And we have a separate document, which is top 10. For those of you of a certain age, like me, you remember David Letterman's top 10 list. I still like to use that. Top 10 reasons to support House File 294. We lay it out for you. A lot of different rationale for that. Our third issue is protect Medicaid programs and funding. We're going to have a fantastic speaker for you. Mary Nell Treffs is the leader of the Medicaid Matters Coalition. And she's going to be taking a deeper dive into this in a very informative and entertaining way. And you're going to understand why protecting Medicaid is so important for mental health programs and services in our state. And finally, our last issue is the continuity of care or non-medical switching. And that is the issue where if you're on a certain prescription medication, and you've chosen a health plan because it covers it, and you with a certain copay or deductible, and then your health plan changes it mid-year, and it becomes no longer affordable for you as a result. That's non-medical switching. And there's a coalition of patient groups that's working to try to curb that practice. And so we have some talking points. That also is a live issue at this point in the session. So with that, I see a question from Kurt. If we live in districts in which our state senators and representatives already agree with NAMI positions, how can we really influence what is happening this year in the State House? And that's a great question, Kurt. And we will be talking a little bit more about that as we go along, but the short answer to that is they still need to hear from you. Because even though they might agree on most things, they might not agree on everything. And also they might have questions that you can answer. And you, by telling them your views and especially sharing stories, you strengthen their stand and their opinion, and you give them ammunition and fuel to take their position. And don't forget to say thank you. If they are in support of our positions and they're working on that, say thank you. You can't say thank you often enough. So that's my 2 cents. And now it is my distinct pleasure to go to Renee Schulte, who is Renee is a former legislator from Marion. She is an expert on mental health policy. She's also a clinician. and she is our go-to on most all things mental health. And we also have Rachel Bertrand, who is an intern with us this semester, and a former student of Renee's, and has been doing wonderful work for us on advocacy, on getting alerts out, focused alerts, and getting people to connect with their legislators in a timely way on important issues. So they're going to talk to us more about how to be effective advocates, especially in the age of COVID. So Renee and Rachel.
Thank you. We're excited to be here. I'm so excited that Rachel gets to be here with me. Rachel was in a class with me at DMAC for abnormal psychology a few years back, and then we've kept in touch ever since, and she wanted to plug in, and NAMI was more than welcoming to let her come and to work with them this session. And so we'll be talking about the advocacy piece that we've really needed at NAMI, but Rachel's been able to help us make it happen. And during the pandemic, things look different. And so we're going to talk now, and I'm going to share my screen so that we have some slides for you about what it looks like to be able to share in the pandemic, because I know some folks are saying that they don't know how to reach out or don't know what to do. Again, at the bottom of your screen, there is a button called Q&A. If you have questions as we're going today, please just put those in there. Nina is monitoring that thread and she'll give us questions. We're going to have questions at the end. So just make sure you take a minute and just write all those things down as we go. And that way Rachel and I can address them. So Rachel, why don't you introduce yourself and tell everybody what you're up to this semester?
Yeah, hi everyone. My name is Rachel. I am a current junior at Grandview University. I live off campus, which is why I have a giant wall of coffee mugs behind me. So this semester, my main focus has been trying to increase communication between constituents and their legislators, making that as easy and impactful as possible. So I've been doing that by doing anything from creating contact sheet lists for our action alert emails to creating some tutorials that we'll be talking about later today.
Yeah, so we've got some really good pieces on how to do some things. And so that same website that they were telling you about before, the NAMIIowa.org site for the event today, has a list of all of these. And we're going to show them to you as we talk this morning so you can see exactly what document we're referring to with a picture. And then you can go to it and get those step-by-step instructions that Rachel has been helping put out. So the first thing we're going to talk about is just what's our plan for this morning. We've got about 30 minutes. I'm going to share with you questions and answers at the end, but we're going to talk about why should we advocate, what those legislative priorities are in a very simplistic way so that you can create your own story to connect to those priorities, and then give you what those options are. How do you connect during this pandemic? Because the State House looks very different this year. So we're going to talk about what are the right ways to connect to get your input about bills in. And this is where Rachel's going to tell us more about those particular how-tos that she's created for us that'll give you that step-by-step instruction. So first of all, the why advocate. So as you heard in my little bio, I'm Renee Schulte. I was a state legislator for a little while back in Cedar Rapids. And so I now live in Urbandale. But during my time in Cedar Rapids, I helped redesign our mental health system. So I went from when we had a statewide county-based system, so 99 different versions of a system, down to regions. And I know regions are not the most effective, and they're probably, the maps always confuse people. And we're going to get to all of that when we get into the conversation on funding in a little bit with myself and Peggy talking about the regions, but it's way better than it used to be. And so advocacy, though, is how we got that changed. And so the changes that have happened, like Peggy just discussed, about getting complex needs policy put into the law, getting a children's mental health system put into the law, all happened because of advocates like you and because of your voice in the State House. And so it's really important that you know what the story is that you want to tell and exactly what it connects to and how that you can help. So let's just talk about some very brief pieces that people forget. But legislators are just people. And in Iowa at the State House, if you go in and look at who has been elected, There's lots of farmers, there's lots of attorneys, there's a lot of bankers, there's a lot of retired teachers. There might be some folks that are currently teaching that take the semester off to be at the State House and go back into the classroom afterwards. There's some mental health professionals. It's a mix, nurses, doctors, you name it. There's a mix of people in that building. So when I got elected back in 2008, I walked in, I came in from Four Oaks was my background. I worked with children and family services, and I was a therapist. I was foster parent, had kids in my home. And when I walked into the building as a freshman legislator, I became the expert on children and family issues at the State House because I was the only person elected that knew anything about it. The only person. And I don't know diddly squat about being an elected official. I don't know how the place runs, nothing, but I became the expert the day I walked in. Sometimes we all assume that legislators know what we know, and we assume that they know how to help us fix what we need fixed. And I'm here to tell you today that they don't, but they're there to work for you. And so it's really important that they know you and that you have a relationship. So some of the work Rachel started with, and I'll let Rachel explain. Tell us, Rachel, some of those beginning emails that went out was about connecting with that. Why were we trying to get people to build a relationship? Do you remember, Rachel, why we were working on that?
Yeah, I mean, if we want our stories to be impactful, we really want to have that relationship with our legislators and to keep that connection going so we can be a resource for them in the future so they know that we're here and we have information and, we're ready to help.
That's right. And so we want them to reach out and to know us. And so I had specific people as a legislator that I would go to about specific topics. So one of the big issues in the day that still seems to be an issue is credit unions versus banks. And there's always this big fight about that. But I didn't know anything about any of that, but I had people in the credit union sector that would work with me so I could understand the issue. And whenever there was a bill, I could call them and have that conversation. Or the same with the banker, or the same with the farming community. That was not my expertise, but I had friends and people in my district that's what they were passionate about. So I could reach out to them when I had a bill. I would think of them because we had been connected, we had a relationship, and I could say, okay, how does this bill impact you? Is it good? Is it bad? And that's who you want to be for a legislator. You want to be that resource. So that's why advocating is so important. And so why people need to know who you are. So let's go through those legislative priorities again. I know those are big topics, big words, big issues, but I want you to think, because today you're going to think about your story and a story that you can tell about one of these three topics. Now, we don't have the ability today to go into breakout rooms because we're in a webinar, but we are going to ask you as we go through today to put some of these pieces back into the chat and so that we can have a dialogue and a discussion. So these are the three topics that you're going to think about. How has it impacted me? So these are just the legislative priorities Peggy just covered a while ago, but these are very simple terms. So sustainable mental health funding. So do you know anybody that maybe didn't get services they needed because the funding was cut? Or do you know somebody that a service that you depended on in the past got cut because your region or your area didn't have funding to sustain it? Or maybe you're in a region or an area that will not build a particular program you really want because they're concerned about not having sustainable funding. One of the issues we have right now is some regions have money, but they're not going to build something new because they don't know if they'll have money next year or the year after that to sustain it. And so that's a real challenge for people because it costs a lot of money to lift up a new program. And yet they don't know if they can sustain it once they do that. And so then they would just lose all the people and all the infrastructure that they just built. And so that's a very important topic. So if you've got stories in your mind that relate to this from you or a family member or a friend, be thinking about those. The second one is Medicaid. Generally speaking, we oppose everything at the State House that creates a barrier for people to get their insurance and Medicaid. Everything. So that could be work. There's work requirements. There's additional, what they're calling, they're trying to do something right now called real-time eligibility stuff, but it was going to make people have to verify their income eligibility multiple times a year. And for folks that are dependent upon Medicaid, just having to keep up with all the paperwork and all of that extra requirement. I don't have to do that for my insurance. My insurance doesn't talk to me 4 times a year to say, do you still have our insurance? Once I pay for it, I have it, right? So why are we putting extra burdens on a particular subset of people that need a different type of insurance? So that's that issue. So if you've had problems with Medicaid, maybe you've been kicked out of Medicaid because you failed to meet a criteria, or maybe they had an old address, sent your stuff the wrong place. That happens 1,000 times. I mean, think Rachel as a student, right? Every year you've got a new address. Who knows if they can find you, right?
Mhm.
And so if that's an issue, so think of that for your story. And then the last one is telehealth. I'd love to be able to see all your faces. I know I can't, but in rooms, if I go, how many of you have used telehealth in the pandemic in the past year? Everybody's hands go up, because without it, we wouldn't have been able to see doctors this last year. And so reimbursement, what we're asking for is for people in the mental health space to get paid the same if you were in the office as if you were online. My license stays the same if I counsel you online or if I counsel you in my office. I actually have additional costs to make sure my online is secure, that my online is private, that my any kind of records I keep at my home are locked, just like I would in an office. And in many cases, people had to keep their office and everything else through the pandemic. So the costs did not just magically disappear because you went online. So the reimbursement should be the same. And the only way to keep that access open for people moving forward is for, if you want providers to do the job, you have to pay them. And the pay is not already not super great at the face-to-face interval. Well, at telehealth, we were getting paid at 75% of that rate going into the pandemic. And I don't know about you, but getting paid 3/4 of what you should be paid for just because you're online, that's not very fair. So those are your 3 topics. All right, so now is where you get to start to practice. And we're going to take some time here, and we're going to let you put it all in the chat. So the first thing we want you to do, and Rachel, I'll let you want to give an example, Rachel, of an introduction of who you are that you might say to a legislator? So if you're going to talk to a legislator, Rachel, what might you say is your introduction as the who you are part? What would you say?
Yeah, I would just say, hi, my name is Rachel Bertrand. I am like your constituent. Like, you want to definitely include where you're living so they know, well, not your address, obviously, but, you know, the town and city that you're in, so they know where you're coming from. Yeah, I think like where you work, how that impacts you there too.
Exactly. Awesome. So, all right. So everybody that is if you're awake today and you're celebrating St. Patrick's Day with us, put in the chat who you are, my introduction. So my introduction would be, hi, I'm Renee Schulte. I live in Urbandale. I'm one of your constituents and I care about mental health. That's my example. What would you say? Just put some folks in the chat that wants to introduce yourselves, and we'd love to see who's all here today anyway. So tell us who you are in your introduction. All right, you guys are good at this. Got some folks from Iowa City. Got some folks from Cedar Rapids. Oh, I've got a friend from Urbandale. Hello. Folks from Ankeny, Van Meter. That's what I love about this conference. We're from everywhere. Oh, hi, Diane. Glad you're here today. There's lots of folks. Thank you all for just saying who you are. So, man, I love this group. You guys are from everywhere. Those stats at the beginning were so exciting to hear how many Senate districts are represented and how many, oh, hey, Leslie, good morning. How many House and Senate districts are represented. You guys are a powerful group of folks. Thanks for coming. Waukee, oh, you're going flying by now fast. Fairfax, nice. Iowa City is well represented in the House today. Good job, everybody. All right. We'll let you guys keep working on that. So the next piece of the story, and this is where it's going to take you a little bit more time, but I want you to think about a story that's impacted you, maybe a family member, a friend, of something, one of our priorities. So telehealth or funding or a barrier to Medicaid, that you have a short story that you could relate to one of those that you would think it would be important to share with somebody. And so if you, as soon as you know what that is and you have a thought, you can share that in the chat with us, it'd be amazing. Otherwise, Rachel and I are going to give it a shot and see if what we can come up with for our own. So what do you have, Rachel? Do you have any ideas for me of a story that relates to one of our priorities this year?
Yeah, I can think of 2 examples in my life. I think definitely I relied on telehealth for my personal counseling and stuff throughout the pandemic. So that like greatly impacted me, and without that, you know, who knows like how the outcome for so many people. But also with funding, I think you might remember Renee had a roommate when I was at DMAC who was having very serious mental health issues. And she was unable to be diagnosed for a really long time. And the solution for a lot of the providers in our area, which we were in Ankeny, was to just like hospitalize her for a little bit, then take her out, and then she would just be in and out. And so she's still struggling. I'm trying to find like the proper care for her. So,
Yeah.
and
And funding can be a real struggle with that, because some insurance plans may only cover that inpatient stay and not cover maybe what was actually needed. And so then, and inpatient stays can only cover maybe a couple of days and you get booted back out again, and then it's not the help you need. So those are perfect stories. Thank you for sharing. Those are good ones. Let's see if I can figure out how to get my chat to open up. Oh, holy cow, I did it. Nope, wrong one. It cracks me up. It does what it wants sometimes. Oh, see, and it flips pages on me. Oh my, what is, oh, there we are. See, oh good, we've got some. Oh my goodness, you guys are good at this. I see some about Medicaid. I see some about having some chronic issues and needing your Medicaid. Absolutely. Telehealth, making sure that it's safe for people. Yeah, one thing that's a big issue with telehealth we don't talk about is a lot of providers like myself. I've had a chronic lung disorder a few years back, so I have scar tissue in my lungs. I really don't need COVID. My doctors are like, if you get it, it could go one of 2 ways. You're young, so I could have no symptoms, or it could be terrible. And the terrible option would be hospitalization, terrible. And so from that perspective, I don't really need to be in a closed setting for an hour with somebody who may or may not have COVID, right? So telehealth is healthier for me, the clinician. And there's a lot of clinicians that might step out of serving people if we can't figure out this online piece, because it's not safe for their health. And so they may not go back to the office. And we already are short in the number of clinicians that we have, right? That's always one of our things, is that we're short the number of therapists that we have. Well, then we need to make the situation safe for them so they can do their work, right? And so that's another thing to think about. So thank you all. You guys are really good at this. So this would be kind of the story. So you'd start with that first section of introduction of who you are. Then you'd start with your story and how it connects to a priority that we have. And so if you aren't sure what your story is, or you're not sure how a story of yours connects to a priority, this is what you want to be thinking about, because when we're going to ask you to reach out here in a second and talk about how to do that, you want to have that kind of idea in mind. Now, granted, you can talk about any story you want. That's true. But if you're going to be an advocate for the priorities of NAMI, your story somehow has to connect to those. And really, with a funding priority, everything connects to that. It's not very hard to get a leap back to funding. And then the last thing is, what is the ask that you want the legislator to do? So based on what you said that your story is, based on what's going on, what do you want them to do? And we're going to talk about some specifics. We have bills related to, there's bills out there for Medicaid that we're trying to stop. There's bills for telehealth we want to move. And then funding, we want them to fully fund it. And you may not know how to fund it. It's not your job, it's their job. So what kind of an ask, and maybe put into the chat based on your story, what do you want them to do? Because the hardest thing for a legislator, I ran for office. Let me just explain. You don't make a lot of money in this gig. We're not California. We're not full-time. We don't have an office and receptionists and folks. That's not it. It's a very part-time job. And you do it to help people. So what's really hard is if people come and just share their story and there's no solution, if there's no answer. It's like, I don't know how to help you. That doesn't make me feel good as a person who wants to be helpful. And that's the same for your legislator. They want to know, how can I help? So you can give them ideas, give them options, give them suggestions. And it may be a bill that's out there, or maybe it's a bill you need them to create because they need to hear you. So think about, what could your ask be? So put some of those in the chat. What kinds of things might we ask our legislator? So Rachel, when you're talking about your friend that you can't find the right kind of service for, what might you ask a legislator to help you do?
Yeah, I think I would ask that for like the full funding, that it shouldn't, be cut based on like the property tax or whatever it is, that there should be something more consistent, and that would in turn save lives. And
Awesome. That's perfect. All right, so let's move on, because we don't have tons of time left. So that was your practice. You get to think through your writing your intro, those examples that you need, and then what kind of an ask you have. And you're welcome to continue to put any and all of that in the chat as we go. All right, so then what are your options during this season at the Capitol? So this season, everything is virtual. Committees are online, everything's available online to you. And so you can actually have more access today not coming to the building than you've ever had before. So there's actually real positives and opportunities to be more plugged in this year if you want to. Now, the old school ways of calling and emailing and attending forums are still the same. So your top line there are still the same. And since you have signed up to be here today, you are on the advocacy newsletter list, on the email list. So when Rachel helps us put together lists of people who's having a forum, and you get an email, and I got one last weekend. It said, "Hi, Renee, Jake Chapman, who is your senator, is having a forum this weekend in this town at this time, or this town at this time. Feel free to join him." And I could know exactly where to go, what time, and NAMI sent it all to me. It was awesome. So I could go. But another piece right now is a lot of these forums are virtual. So you don't even have to leave your house. And so there's lots of these around, and they're being promoted. NAMI has the list. We are sending those notices out to you. So you might not have noticed that you've gotten these emails. They might have gone to spam, but I'm telling you to go find them, because we can show you exactly where your legislator is having a forum and when and where to go. Now, the bottom two is where Rachel's going to shine here and going to tell us about this. So I'm going to walk through this page, and then she's going to give us our how-tos on the next several of how this works. And there's handouts on exactly how this works in your webpage. So here, so that you can, your event page has all of this on it. But subcommittees now they take public comment virtually. So you can leave comments from anywhere. Committees are fully viewed online, and we have how-tos to show you exactly where to go to on the legislative website. And you can leave comments directly online into each of those committees and each of those subcommittees. And so Rachel is going to help us now walk through these, the how-to pages as soon as it switches. Hey, now here's one piece of interesting factoid for you. The House and the Senate are not doing virtual meetings the same way. The House is using WebEx, and you can watch it live, but you cannot comment live in a subcommittee in the House. The Senate is using Zoom, and you can comment in the subcommittees on Zoom. So there's two different versions, so therefore you have two different how-tos. So if you go to your page for the event today, the NAMI.org event page, you're going to see this document called Watch House Meetings in 2021. So Rachel, I want you to walk people through how they would watch these meetings in our pandemic.
yeah, awesome. So I just have this how-to document pulled up on my side. So if you guys are not already viewing that, I would encourage you to pull that up right now. So what I formed this based off of was like the email that you get from us. I would be like, "Hey, Renee, there's a House meeting on this bill, and you should attend and advocate and all those things." So the information that you should already know would be included in that. So the bill, the chamber, where the bill's at, if it's in the committee or subcommittee. And like all great things, we'll start at the Iowa Legislature website. And so that can be sometimes hard to manage, but as you'll see on this doc, you can always click the top blue bar where it says Iowa Legislature and it'll take you back home. And also at the top of this website, there are 10 sections. Starts with Senate, House, ends with the archives. And so we'll click on the committees and schedules. And then under that tab, we'll go to meetings. And then after that, we just have to find where the bill is. So if it's on the day that you're looking at this, you'll go to one of the daily sections, or if it's within the next 2 weeks, you'll go there. And so we'll just navigate to wherever that is. And from that screen, you'll be able to view all the different committee types, the chambers, and the dates. And for the House meetings, you'll just be able to locate your bill, scroll down to where it says location and click the camera icon. And after that, it'll pull up a WebEx link that you'll be able to click on. And yeah, like Renee said, you're not supposed to comment out loud or anything during those. So that's how that works for the House meetings.
So we had a question about whether or not we should be able to see your screen changing, and the answer to that is no. You need to be able to pull up the document yourself so that you can use it. We're just walking through how it actually works. We did not throw a live screen changing document in here. With the State House being the way it is, that gets very complicated. And so sometimes it crashes. So we didn't want to crash the entire webinar by pulling the State House screen in here for this minute. But so generally speaking, though, the web way to do this is you get into your legislative, so it's legis.iowa.gov, which is the same site all the time. And you can go kind of step by step for how to get to the House. Now in the Senate, she's got a different document about watching Senate meetings, and it's very similar, right, Rachel? Is there anything specific you want to point out about that?
Yeah, it's all the same steps, basically until you get to the screen where you can view all the different meetings for whatever time period it is. And instead of going to the location of where the meeting is, all you have to do is click agenda, which is on the rightmost side of the page, and then it'll just pop up the Zoom link and all the different information about that. That's really the only thing that's different for the Senate meetings.
Okay, and then one more in the same spot, there's a place to leave comments. So would you like to talk about that one, and then I'll show how it works?
Yeah, for sure. Awesome. So yeah, it's all the same steps, which is kind of nice. So it's not too easy to get lost with these ones. But right where next to agenda, you can click public comments, and it'll pull up a screen that provides more information about whatever bill it is you clicked on. It has the different subcommittee members and dates. And to leave comments, you want to make sure you're doing this before the committee meets so they can see it, and you'll have access to leave a comment. And when you do that, you'll also be able to see comments other people have posted too. So then on that screen, you'll just hit add comments and then fill out your personal information and basically apply all the things we talked about earlier. Give your intro, share your story, and share your ask too. And then at the end of that, you just have to click that you're not a robot and submit.
That's right. And so when I work on, so I'm the lobbyist for NAMI, one of them. There's 4 of us on your team with Policy Works. And when we work on bills like these, we can leave these comments, and I do, or you can call your legislator and talk to them about them. You can email your legislator and talk about them and put in the subject line that you're sending comments on whatever bill it is for a subcommittee or a committee, and email that directly to them. There's multiple ways to do it. So most of the time, I will send a comment about a bill, depending how strongly we feel about it, multiple ways to make sure that they for sure get it. And so I can have conversations with people. Legislators are doing one-on-one Zoom meetings with constituents if you email them and request that. So it's really going to be up to you on how to do it. Now, the pieces that are not available to you, there's no going to the building and sending notes in and out this year. There's no going to the building and sitting into Senate committees. None of that is a thing. So we want to make sure that you know that there's lots of new options available virtually. And the conversation with the Senate, the chief of clerk in the Senate is considering keeping this for next year because of how much more engagement we're getting from the public around the state and how many more people are able to be part of the conversation because it is virtual rather than making everybody come and then cram into those rooms. And there's always kind of standing room only where people don't always get in. And so they're really thinking about leaving this as because it's become such a new tool and helpful for people. So what we're going to do now is we're going to take questions. And I know there's some very specific questions in the Q&A, and I will answer those personally to you directly because they don't necessarily apply to everyone. So I'm not going to do those live here. But if you have questions that are more in general or specific about how to advocate, we will take them now, and you can put them in the Q&A box, or you can put them in the chat, and Nina is going to be letting us know what might be out there. So Nina, is there anything Rachel and I can answer a question for related to how this works this year?
So far, Renee, all I'm seeing are very specific questions. So I'll just let you answer those via text.
Awesome. Does anybody that's out there have any specific questions for us? Rachel has done, so the other thing that's going to happen, we haven't got it quite finished yet, but on the page that you see for events that now has the how-to documents, she's working on creating little video tutorials. So if you're a person that would rather see it, and I saw a comment earlier about wanting to see it, we're going to have little videos. Those are getting done. She's on spring break this week, but as soon as she gets them, I know she's got a friend helping her kind of edit. But once those things are put together, they'll be put onto your event page as well. So you'll have the documents, so you can go screen by screenshot with pictures, or you can do a video of how to. So those are going to be coming for you. Just want to make sure you know those are available. But thank you, Rachel. You did such an awesome job today. It's fun doing this with you.
Yeah, it's been great.
If you don't have any more questions, I can turn it over to Peggy. I guess you and I are up for the next topic.
We are.
Renee, we've got one that I think could be a good one to cover.
Okay.
What if I never hear back from my legislator? What should I do?
Well, if you don't hear back from your legislator, that means you haven't sent the message enough times, for one. They'll be tired of that if you continue. If you don't send it, you may need to send it in multiple ways. So you can leave messages on the switchboard at the Capitol. Their cell phones are public information, and you can send it to their cell phone. You can call them on their home phone. You can send it in an email. You can write them a slow snail mail letter, and you can send it lots of ways. So don't give up just on email, because email, there's a lot of email this session. Email's probably the least on the priority list for people to respond to. So send another way, get their attention. You can do this. So you may have to show up where they go to coffee on Saturday. I mean, whatever those kinds of things are, but those kinds of things are really important. And if it's important to you, you need to just keep sharing until you hear back. It's asked me to go through how to find your legislator process. So Peggy, don't you have the how to find your legislator? Everybody that signed up for today, if they knew their legislators, had to tell us to register today, right, Peggy? Mm-hmm. And if they didn't, y'all sent them an email with who their legislators are. I think you did that before everybody joined today. Yeah, Mary, I think NAMI did that today for everybody. So if you didn't see your email, you need to go look in your inbox. But Zach and the NAMI team made sure to send you that information. So when you registered and she said, I don't know, they told you. So you should now know who they are, and then make sure you find the emails from NAMI, from Rachel, from Lauren, from the folks that are sending them to you from NAMI, so that you can make sure that you get them, because we're sending you exactly just what you need to talk to the right people. So we're trying to make that very easy for you.
Okay, Renee, I've got another one for you. Mm-hmm. So the comment is that it would seem that we would need to talk about specific needs that will be met by increased funding. So I think maybe clarify a little bit about when we talk about funding, what are we asking for, and maybe clarify that it's not really increased funding, but just that we need to fund the services that have been passed in previous years.
Yeah, so what you're trying to tell people, the main issue is that the numbers have been frozen since the 90s. So if you think of any county in Iowa that has grown since the 90s, so think of one, pick one: Polk, Dallas, Johnson, Scott, Lynn, Johnson, Woodbury, all of them are struggling because we haven't kept up with population growth. So even if you just know that one fact, that will help you, because you don't need to know what they're going to spend it on. You need to know that we've got some significant deficits across the state, and other regions, and it may be yours, isn't building what they need to because they don't have any way to sustain it. And though they're going to tell you that, and they're going to say we can't build children's services because we don't have funding to sustain it. So all you need to say is, look, we need a sustainable funding system that is predictable, that grows with our population. That's what we're asking for. And legislators don't even know the specifics of how it would be spent. So that's not a detail.
Renee, I had one question that occurred to me that maybe you can address. I get asked this a lot, and that is it helpful for people to contact legislators other than their own?
It is, depending upon who they are and how they're related to the bills. So if you're talking about a Senator Edler who's in charge of policy, human resources policy in the Senate, he is the chair of that committee. He can hear from anybody and everybody about moving a bill because he gets to choose what bills move. And so he should. Now, if it's somebody random that's a farmer who doesn't sit on any of these committees and they don't really know about these issues, that's not going to be as welcoming of a response from them to you. But that doesn't mean they shouldn't hear about it. I mean, you can send it to anybody you want to, but there's a strategy to who. So people in the leaders of the caucuses. So if you're a leader, so if you're a Jack Whitfer, a Jake Chapman, a Zach Walls in the Senate, or you are a Grassley or a Winchittle or
Pritchard.
Oh, I'm blanking on Pritchard. That's right, Rep Pritchard in the House. Then they hear from everybody. That's their job. They're a leader. And so if you don't know who, you could send us a follow-up email after this to NAMI, and we'll make sure that you get those lists of exactly who to talk to.
Thank you.
Yep, I'm going to answer these questions in Q&A here in a sec.
Well, I would like to thank Rachel for everything, not just for being with us today and helping us through this how-to, which we really appreciate, but for stepping up and being so helpful and such a leader in our advocacy efforts as an intern for us this semester. You are a great example of a young woman providing wonderful leadership, stepping up and making a difference. So thank you.
Yeah, thank you, Peggy.
Yep, and I appreciate the fact that you used, the hard times you had at DMAC as part of your advocacy story now, right? And you can use that story to help, and you've lived it and you've had your own life experience, and you're like, look, this is part of who I am, and I want to help other people. And so thank you, Rachel. It's been great working with you.
Renee.
Enjoy your rest of your spring break.
I will.
All right, we're going to talk about budget, right, Renee?
Oh, that's right. So do you want me to share the slides? Let's see if I can figure those out.
And I'm going to just preface this by saying that, I actually just did a briefing for an official who's been involved in government and taxes and stuff for quite a long time, but just said, I don't understand how the mental health property tax levy works. Can you help me? And I was pleased to try to do that. A lot of times people's eyes glaze over when we start talking about how the mental health system is funded. And I get that, but it's important to understand, at least have an overview, because it's so crucial. This is how things get paid for in our state. And you don't have to know every detail. You don't have to know all the ins and outs, but it does really help to have a general understanding. So that's what Renee and I hope to provide today.
Yeah, we're hoping. My slides are causing an issue. It'll just be 1 second. Who knows what you guys are going to
I
see?
can
You're
keep
going to see
talking.
see my whole crazy computer because it's like, what is it doing? All right. Go ahead, Peggy. You've got lots to share.
Well, and also to preface it by saying that a lot of people don't understand that our mental health system in Iowa is the responsibility of, not of the state really, but of the regions, 14 regions. And so they're the basis of how this is structured. And look, we have the slides.
We have slides.
Yay.
All right. Would you like me to move one ahead? So you want to share? So Peggy, this was the original of this was done by the Department of Human Services for the House Human Resources Committee earlier this year. And so the entire document will be available for folks on the same site where you've got all your resources. I sent it to Zach to get it up there so people could have it. We've edited it down a little bit to be more specific to what Peggy wanted to talk about today. And here's sort of the overview of what we're going to talk about in this section, just really talking about the regions and then how COVID has impacted all of this. And then we get a lot of questions about children's services, complex needs, the children's system, crisis. And so we've really cut some slides and these are DHS slides. So we may or may not be able to answer the specifics about some of the information on the slides, but we do know where we can get the information for follow-up if you have more questions. So Peggy, I'll just let you kind of go ahead and talk about the regions, and this map is always one of your favorites. So share your thoughts on the colors.
It's very colorful, isn't it? It's very colorful.
It's very colorful.
Yeah. So we get asked a lot, how did this come to be? And Renee was actually part of the group of legislators that worked on mental health reorganization, going from 99 counties to 14 regions. And the short answer is counties were allowed to join up with who they wanted. It was up to them. The only requirement was that they had to be contiguous. There was no minimum size or maximum size. Now, that being said, they have changed a lot since they were first conceived. Counties have moved in and out. They have disagreements. They don't agree on how to pursue strategy or funding or whatever, so they've moved to different regions. And one of the outcomes of that is that actually, was it last year, Renee? The legislature voted to allow counties to not be contiguous. So counties can join up conceivably with any region they wanted. They don't have to be geographically contiguous. And we
I'm
really
not totally sure if that completely passed. They ended up making that a thing for, remember that group that was on, like, I think it's the Franklin, Hardin, Hamilton kind of crew there in the middle that was in the Bob Lincoln Big Blue region at the time that wanted out. And so, but you still have some standalones in here. We've still got Wapello, looks like it's not quite connected. And
Emmett and Osceola are both are like orphan counties.
Yeah.
But that's why I get asked a lot, well, why this patchwork? And you know, there are a lot of other regional systems in our state, right? Area education, there's aging, there's lots of different
Yep.
Oh, and here's Emmett will be switching to Sioux Rivers as of July 2021. All right.
Well, there you go. Now you know.
And it changes every year, literally. So, but this is what it looks like right now. And they are, these are through 28E agreements, which are intergovernmental agreements where the counties within the region all contribute to the budget of the region. They don't all have to levy the same, and for the most part, they don't. They agree on a regional budget, and then they agree on what they're all going to contribute to that. a lot of the employees within the regional, the MHDS regions are actually not employees of the regions per se, they're employees of the counties. And a lot of the buildings that they work out of and buildings that they use are owned by the counties, not by the regions. So I just wanted to make that point because that's something that a lot of people don't understand. And it comes into play if you're talking about the state taking it over, because there's a lot more to it than just the regional budgets. Right, Renee?
Yeah. I mean, we could go on forever about how we got here. I was working on building a statewide system back in the day. I was told that that was too big of a jump from 99 to 1. And so we needed to do regions. And it has been a learning experience from the get-go. So nobody designed it to look like this. This is not a planned situation, which should be evident by the colors. And we are hoping that it continues to improve. And so what needs to happen for this to actually improve is the state needs to have some money in the system. If there's some money in the system, or the state would have some say in a stick, if you will, for some of this stuff to get kind of put back in some sort of an order, I think that would be helpful. And so that's some of the funding conversations happening at the State House, as whether or not how to go about putting some state dollars into the system. And we could have a little bit more oversight for some of this stuff, because a lot of what you see right here is actually personalities. A supervisor gets elected in one area and decides they don't like somebody else, and then all of a sudden they can't be in that region anymore. I've watched that happen a dozen times in the last 5 years. And so, you know, that shouldn't be the reason why we pick mental health regions. And so we need to talk about like other ways to make this better. So the next piece here is just like some of those new services. And Peggy, you talked about this before about the 27 expanded services. And that's where this kind of comes from, is right here. These were the bills that passed, and the total number that expanded was 27 services that are core. The idea with core services is that some regions are paying for things that were not, there was no research showing that they were efficient or effective. And they've just sort of what we used to call legacy services, spending money on things because we've always done it that way, but not because we were actually getting very good outcomes. And so the concept was for the state to help put core services into place to give everybody, first of all, a standard of what we should be shooting for, and then for access for people that no matter where you lived in the state of Iowa, you should be able to expect base level services. Now, this was not a ceiling, this was a floor. And you'll see that there's a couple of dates here coming up where these things are supposed to be in effect. And there's some real pushback on this. And I thought, Peggy, you might want to talk about some of the pushback for the expansion and what some of the regions are trying to do with that.
Right. So I served on the complex needs work group that originally came up with this set of recommendations. And miraculously, everything we recommended was actually put into a law. And that was really a very proud moment. So now we just have to get them all implemented. The one that a lot of people know, and probably the first up in terms of deadlines and implementation are the access centers. We're supposed to have 6 access centers by July 1 around the state. We currently have, now correct me if I'm wrong, Renee, but I believe it is 3 now, in Centerville, Johnson, and Lynn counties. Oh, Darcy says we have 5. So Darcy, you need to inform us about, I don't know about the other 2. And whether or not they're actually deemed access centers by the state, I think would be another question. But that's a first thing. And among other provisions in that law were expansion of ACT teams from 11 to 22, establishment of intensive residential treatment group homes, or IRSH, and making all crisis services core were among the other changes in the complex needs law. And those are all spaced out over a period of time. So they, it's not like they had to do them all at once. They were spaced out. But some of the first deadlines for things to be online are coming up this July. And then House File 690 was the children's mental health law, and that passed the year after, 2 years ago. And there's a series of, there's some deadlines for things to be implemented out of that bill coming up as well. And that's also the responsibility of the regions. So regions provide quarterly data on access to core services. And this slide deck that we're showing you today that was presented by DHS with their permission, I just want to point that out, because we had asked Marissa to present and she wasn't able to. And she said, use my slide deck. So I have some really good information. So we just wanted you to see it.
So now we're going to talk about what happened in COVID and some of the funding that happened here. And through COVID, there was specific funding that came down through the federal government for COVID, and $30 million of that went into regions, and it was distributed on a per capita basis, meaning that your larger communities got more money than others. And you'll see that they had actually spent 20 million of it as of the 31st of 2020. And so there was 10 million that they did not spend. And I know some people may be thinking, well, how in the world would you not spend it? But again, if you're trying to think about how to use it on services or maybe to build services, this is where sustainable funding is such a big piece, because you could go out and build a facility, you could go out and build an access center, but if in a year from now you don't have the money or the capacity in your levy to pay for it, that is not a very fiscally sound move. And so, or if you have the levy ability, but your levies bounce where they drop them to zero because of paying down the ending balances and then they go high, constituents don't appreciate that. And so it gets very difficult then of how to figure out who you can spend it on. And there was criteria of what they could spend. And so you can see that the expenses are going to go through June 30th of 2021, so that they'll still be able to spend that additional 10 million. We just don't have an update where that is, but there's a long list of what they could spend it on here listed. That virtual technology we talked about, there was lots of people who didn't have that. A lot of social workers, especially within the Department of Human Services, didn't even have cameras on their computers. And so you can't just flip to virtual if you don't have equipment. And that was true about a lot of different providers. And needing to flip to virtual, we had to move fast in that. And so a lot of people needed help. And so there was some financing for that. Of course, PPE, all the different types of services that needed to be increased during this time. And so this was some of that monies. Additional monies came down through SAMHSA. There was a national increase for mental health services, block grants increased. Right now, there is a lot, I will say a lot of federal dollars out there for lots of projects. And so there's a lot of grant funding, but again, it's got to be used for certain things within certain parameters and criteria. But we have expanded again the certified community behavioral health clinics. We're up to 8. We've gotten 2 large groups have come on board the last 2 cycles. And so we're up to 8. And so there's a lot of additional dollars coming into the state that way. And so that's part of the conversation. And then the last part I will say before I turn it over to Peggy for crisis services is COVID Recovery Iowa. And I've actually been working as part of this grant. And this particular grant is not taking over the therapy of providers. There's a lot of confusion about what money came for this. But this was that gap for people knowing that there was providers and therapists available. And so what they did was, it's kind of like what they're doing now with the navigators for vaccines that just finally started. We were sort of that navigator for people, helping connect by taking frontline calls through our 211 system, your Life Iowa system that was already established, but taking in the warm line at the Abbey Center. So taking calls through those already, but helping them get connected to services. My job specifically was helping with employment. So lots of unemployment questions, lots of eviction, rental assistant questions, home food insecurity issues, all those types of things, and then getting people connected to who already does those programs. So this program is slated right now to end in June. There's some rumors that it might continue forward, but you'll see a lot of Iowans were involved in this. It was all 100% virtual. And then when the derecho hit last summer, the federal government went ahead and added additional funding to this grant to deal with the derecho also, because they were already on the ground. And so This COVID Recovery Iowa is still available, still working, but it's a little bit different. It's kind of that very front line. So, you know, we do things like reach out to businesses and make sure that they know that these services are available, or that there is a warm line, that there is a hotline to call, that they can call 211 for resources and services, you know. So we were kind of that gap filler, not professional therapy services. So here's crisis services, Peggy. So you want to share how these are laid out across the state?
Sure, but I want to just say one thing about that one-time funding, and that is that if you think about it with your own budget, so let's say you have a one-time source of money from somebody owed you some money, or you do a one-time project or job and you get paid for that, or you get a big tax refund. And thinking about how you're going to spend that money versus money that you're earning and you can rely on from your job or whatever other source that you get. That's the situation for the regions and for providers, is that they can't use this or don't want to use this one-time funding to start new programs, because it's there's no guarantees it will be there in the years to come, and you don't want to start new programs without being sure of the funding source down the road. So just wanted to point that out. That's another question we get asked a lot. So crisis services. If any of you have seen that triangle of services, and crisis is at the top, and it affects a relatively few number of people, but it obviously is of great concern and needs to be taken care of. So it was made a core service for the regions. And here we can just go through these slides pretty quickly, but they show crisis mobile response, developing or met. This is crisis stabilization, which is short term, it's just 23 hours. And then there's crisis stabilization residential services, which is a little longer term for de-escalating and stabilizing individuals. And you see that all the regions have met the standards, the state standards on that particular thing. I think that, okay, here's the 23-hour crisis observation, sorry. And for those of you in Polk County, if you've ever been to Broadlawns and you've seen their setup, I know other places have similar settings. It's usually a room with recliners in it. People might be separated by curtains, and they're really just, it is meant to be just a short-term observation and de-escalation crisis setting.
Yeah, and I know Darcy's on here, and one of your comments was that some of this stuff was older, and I believe that they take those stats from what you reported into June of last year, so June 2020. Oh. And so when you do that state report, I believe that's when it is. So things that have opened kind of since then, unless they were on the projected date to open or something like that. So there's always a little bit of a lag time. But that's just a compilation image of the state of the regional reports that go into their system. But
and this was and this report was done late January, so it's right. Yeah. And
things are always moving in the regional system, so it's always moving and developing.
Do you want to explain subacute, Renee?
Yeah. So complex needs. There's some of these and. So one of the things that we talked about this year, and I know there's a couple different issues. One, regions are concerned that, you know, the July 1st date's coming up and they might not have been able to implement some things. And in having conversation with DHS, their way of thinking is you can see either if it's a region issue where a particular region hasn't developed a whole lot of things and they're the only region, like a standout region that just hasn't been able to pull something off, or if there's a service where almost nobody has it at all. And in this category, you're going to see a little bit of both. So you're going to see subacute facilities here. This is the group that is where you're trying to get people to not be put into inpatient hospitalization so they don't they're not quite inpatient level of care, but they need a high level of care they need to be able to have an intervention, and it's attached to, it can be attached to access centers, or it can just be another level of bed. But it's actual facility as far as requirements with psychiatric requirements and such like that. And you'll see some of these regions have been working toward that. This is one of the more expensive levels of care. So again, regions that don't have extra money, that are really struggling with financing or funding, aren't maybe going to be able to build this the way you want to. Assertive community treatment teams, same situation. So this may be another dated visual for you. You'll see that it's either met or developing in all the regions. And so you've kind of got this picture that goes with that of where ACT teams actually are serving which counties. And you'll see there's still a bunch that don't really have that ACT team logo. And again, this is probably, it says as of September 2020 in the bottom corner. So there's probably more that has come online since then, but you'll see that the areas that are still struggling really are rural. And that's not always just windshield FaceTime as it is workforce. We don't just have mental health folks living some places. And so that can be more challenging. And so assertive community treatment programs, they have done some work to make the team a little smaller if it's needed to be done in the rural community. So it doesn't have to be as large as an urban team, but they're still not going to be all the people that you might need. And this is a service that you'll see the state may have a problem with, right? Because if no region have pulled it off and only one's in development, there's something wrong with what the state's asking. And what's wrong with what the state's asking is the state's not put a dollar amount on how much they want to pay for this. And so there's a lot of regions out there that are concerned about building these residential homes, not having any clue what the reimbursement mechanism or rate would be, and they don't know if they can sustain it. And so it's a chicken and the egg situation. I think the state hopes that they'll just put them up and then they'll do that whole crazy cost reporting situation and try to figure out what it costs and what it's worth. But regions have been burnt a few times on some of this. And so this is one that the state may have to go back to the drawing board on and figure out what they're going to do, because there's only one region that's even saying that they're trying to develop this at the time of this report. And so that's a real problem for the state, because the state didn't give you enough information. If no region is biting, then we've got something else going on. And that's kind of what the state is saying, is like, okay, this is one that's going to be a challenge that we as the state need to address, not just make it a regional issue. And here's your access centers. I know Darcy was sharing that there was 5 of them out, but at the time of this writing, everybody was in development, but there are 5 in action. Just for all of you that are involved in this category, there's a bill going through the State House right now. It made it through the committees in the Senate. I don't even think it's made it through the full Senate floor, because it was, quote, to be amended, never saw an amendment. It has big problems. So there's a bill, and I was not even about to share a bill number with you because it has big problems. But the bill was trying to make access centers, what would you call that? Secure, so that you could commit people to them, which, okay, that's a thing. But the way the access centers are defined in code is that they can be virtual, and they can be a collaboration with multiple entities, and you cannot virtually commit somebody to nowhere. And so as long as it's written like that, that's a problem. And so we get what they're trying to accomplish, but it was going to cause a lot of problems. And that is one of the bills at the State House that we're hoping to fix and help amend and move forward, maybe help people study, like the 5 of you that are already in existence being at the table about, you know, changing the rules midstream would be very problematic for folks that have access centers out there. So how do we have them have a voice in that conversation, so that we don't throw out the good that's being done in the access centers that exist, but yet if there needs to be a more of a secure component of it so that we can help the sheriffs and deputies and what they need, is that just another gap, or is that this? I mean, there's a lot of conversation to be had. So you'll see a lot more conversation about access centers. And then here, Peggy, I'll let you talk about services for kids, because I know you served on this work group. It looks like there is, oh, yep. So the core services for kids, they make a very interesting little list here at the top, but it's more about timeliness and proximity and how far people are away from things, I think. But it looks like lots of people have children's services, so that's really good.
Yeah, it is. I wanted to back up for 1 second, Renee, and there
Yeah.
was a question asked about subacute.
Oh, I didn't see it.
And
Okay.
I get asked that a lot. What is it? What does it mean? And as the name implies, it's a level below acute or acute inpatient treatment. So it's one level below what you would get in a hospital psychiatric unit. But it is a level that has been identified as being appropriate for a lot of people in that stabilization assessment phase. It's a lot of hospitals have been hesitant to offer these beds because they get reimbursed at a lower rate, and they're a little scared that if they open beds at that level, that then the payers will try to funnel everyone into those beds instead of acute care. So
subacute, as it's written, is supposed to be like 14 days or less. It's not supposed to be, it's not transitional housing. It's not all of that. And I know providers have tried.
Medical level of care.
Yes. And I know providers have tried to use it as a lot of different things, but subacute is actually a Medicaid eligible service that the federal government has defined as what it is. And so it's not a catch-all for everything. And so it's actually can be Medicaid funded, which is important because that's one of the reasons why it's in a core service. One of the other questions I get a lot is about how is it different than transitional housing? And the way that's different is Medicaid doesn't fund housing. That's what regions have been paying for. And so I've had supervisors want me to put transitional housing in core, and that really is an unfunded mandate to regions because they will never get Medicaid funding for that. And so unless we change that at the federal level, that would be a different issue. I backed up here to see a couple of other questions. So a question on COVID Recovery Iowa. Yes, you can call into COVID Recovery Iowa and they can give you a list of who can do therapy. I don't think there is a master list of who does telehealth for therapists in the state. That's not a thing, but they can definitely get you put through providers who can take you. COVID Recovery Iowa works with 5 specific providers that are part of that particular grant, that they can go to all of those who all do telehealth, or they can get you a reference into your local area. But the beauty of telehealth is you can go anywhere in the state of Iowa and you don't have to be in your local community. So I know I saw a comment about somebody saying, I live in a small town and telehealth has been a godsend because not all your neighbors don't know you're in therapy, right? That is absolutely the truth. And so that's a benefit of telehealth. And so the issue now is because some people are transitioning back to in-person is you're going to want to have that conversation. Are you going to stay telehealth your entire relationship, or are you going to want to go to live? And then you should stay closer to home if you're going to go to live because you don't going to want to transition across the state. So that matters as we wind down the pandemic, whether or not you're going to want to be in person. Crisis services, better or worse? I don't know if the slides can tell you better or worse. The slides are telling you where they are represented. That's it. And the slides are also telling you where they're represented in a region, not that the whole entire region necessarily has it. The check mark comes in that somewhere within the region, this service exists. It does not have to include the entire region. So the boxes probably don't show the actual quality of services being provided.
I would say crisis services are certainly better than they were 5 years ago. There's no doubt about that. There are more of them and there are more trained people. But that doesn't mean, in my opinion, that they are where they should be, especially not, I know we have a slide about that for kids.
Yep.
Just because a county or a region has crisis services in place is often for adults, and then they apply it to kids. But best practice for kids is no uniformed officers. So if crisis services is using uniformed officers to respond, that's not the best practice for kids, and actually not for a lot of adults either. So
Right.
it's not a comment on the quality, or as Renee said, that it really is available everywhere within, especially if it's a big region. It's just the check mark just means that it's there somewhere.
Right. And so on this particular slide, you'll see a lot more red on the right, and this has everything to do with timeliness and proximity of that inpatient therapy. And for kids, getting into beds is a big problem. And I know you've all heard those stories. NAMI has done some great training on that with the governor. There's been lots of conversations in the newspaper about this. This is not a problem that's going away, but it's evident on the slide deck because you can see which areas really struggle with it. And what's really sad, in my opinion, on this particular slide is the Eastern Iowa MHDS region. That's over in the Davenport Quad Cities area. It is not for a lack of beds. There's a different something going on because they've got big hospitals of mental health over there. And so you've got challenges. And so it's not always about just providers or there's workforce challenges, there's funding challenges, there's just a lot of different pieces. So when something is missing, it's not as easy to just say this is the cause of why. It's usually a collection. And then this last one about, we'll break out some of the crisis services for kids in a little bit separate here in just a second. But this last one here talks about like that education, prevention, early identification, early intervention. And again, you're going to see that this is where the state's looking across the regions, and there's some challenges. Certain regions are struggling across the board in a lot of categories, and they're going to have some other conversations about what they're going to do. And maybe that means they're too small and they can't do this all themselves, and they need to consider joining a different region, or what are the challenges in some of those areas. So when you've got sometimes we feel like, well, reporting doesn't do anything because it's just checking a box to make it look like it's there, and that's not enough. True, but it does show on graphs like this some real big gaps. In certain regions are really struggling more than others. And so on this one, a fascinating point for me is education and prevention timeliness in Polk County. And that's everything to do with their budget deficit, because education and prevention was lower on the priority list as far as core goes for them. And so they've had to cut some of that. And so they've struggled to meet, the biggest county in the state you would think would have education prevention, but because they have a deficit, they haven't been able to meet that match. And so it just depends. You can't judge what's going on just by a snapshot. This is more of showing, okay, that we've made progress across the state, but there's still some big issues. But here's your mobile crisis for kids. And again, it does not say what Peggy just said about whether or not officers are present as part of this or not. That's not a criteria that they've been looking at. But you'll see some regions really have this, and some regions have had this a long time. JFAST in the Lynn County area that's in that MHDS East Central region, JFAST has been around forever. And so that's been a long-term thing. That's back when I was a therapist in foster care back in the day. And so that's been around a long time. But some of these others are new, and you'll see that they still are developing, building mobile crisis. And then the same holds true with crisis stabilization. This is where you start seeing bigger gaps. And to Peggy's point about regions not having funding, people are not developing some of this because they don't have the funding to sustain it. And this is where it's starting to be a big problem. And the next one, same way, residential is the same way, even, just little bitty things started and not really there. And if you talk to regions, they're like, well, in some cases, they just don't have it to bake it, or they don't have the workforce, or they don't have, there's just a lot of things. So we've come to the end, Peggy. I think we've got some questions. See if I can pull up the Q&A box.
One of the questions, Renee, was why can't Polk County just raise their property taxes? And
right.
Well, Polk County can raise their taxes, but they can't raise the mental health property tax levy.
That's correct.
There's a specific levy for a specific purpose, and there are not one, but two different limits on this levy. One is a dollar amount, And that there's an overall state dollar amount as well as a per county dollar amount. And then there's also a per capita amount, which is $47.28. So either one, you can be at your limit. So the problem is that growing counties like Polk with growing populations are stuck at their dollar cap. They can't go above that. And so the per capita has gone down and down and down. Now the per capita applies more to counties who are losing population,
Right.
because they're stuck at that $47.28. So it can catch you either way, and that is the dilemma for regions and counties with the mental health property tax levy.
Right. So let's see, I see May has joined us from the East Central region. And yes, we've talked multiple times about the fact that the report was from last summer. Yep. And so it's a little bit dated on the data, but this is the most recent report, May, that DHS shared with the legislature. So we're just resharing data that they had given us. And yes, we are aware that it is delayed. That is correct. Let's see. Another one here is like, Does anybody else have any questions? You can stick them in the chat, or you can put them into the Q&A box. I have answered. If you put a Q&A in there that was really specific, I answered you and or gave you my email address to respond. Go back to the Q&A box. At the top, there's a tab that says answered, and you can read my response to you. And you can send me a new one if you didn't like it. That's fine. Happy to help with that if you've got any more questions. Otherwise, I think we are pretty close to on time for a break. Miss Peggy, you got
I would just add too that if people have specific questions about you need resource or referral, we offer that in NAMI Iowa. You can email us at info@namiiowa.org through the Office of Consumer Affairs, or you can give us a call at our office. And we have Emily Berry, who's a peer support specialist who helps connect people with information and the resources that they need. And we can also take a look at the regional map, and we can connect you with your region, which should be able to help with specific services in your region, and connecting with those. There was a comment about education I just want to quickly connect to, and that is I serve on the Children's Behavioral Health Board, as Renee said, and that is co-chaired by the heads of the Department of Human Services and the Department of Education. And there's a reason for that, because that's where kids are. And we're going to deal with children's behavioral health. We have to include the K-12 education system. And they're an integral part of it. And you're seeing more and more services being offered through schools, including telehealth. And I think you're going to continue to see more of that. And you will, one of the mandates for the children's services is screening. And we have some suggestions about that, which are being pursued. And you will see mental health screening at some point, probably through at least some schools, maybe not all, but they are part of the system and part of the solution. It is really my pleasure now to introduce our next speaker, Mary Nell Treffs. Hi, Mary Nell. Mary Nell and I have been working together on Medicaid issues for a few years now. She actually presented at our Day on the Hill a couple of years ago and was a very highly rated, I believe, Mary Nell, our most highly rated speaker of the day. So she's very good at what she does. She's really knows this stuff backwards and forwards. Medicaid pays for 3/4 of all behavioral health services in our state. It has become increasingly important, especially because of Medicaid expansion, making a lot more people eligible for Medicaid services. So we need to be vigilant in protecting it and expanding it as we can, and keeping it as accessible and with as few barriers as possible. So with that in mind, please join me in welcoming Mary Nell.
Thank you so much, Peggy. I don't know, I think you set the bar a little high for me today. Hopefully I can live up to expectations. So I'm gonna go ahead and share my screen here. And if you hear a little voice in the background, I'll have Grace join me really quick so she can say hello to everyone. So she's the source of the noise, but she's learning a lot about Medicaid this year too. So let me just get my slides ready to go and we'll get going. All right. So as Peggy mentioned, I am going to be speaking about one of the barriers that we're facing for accessing Medicaid. And that's a particular set of legislation that I'm going to walk through today. But I did want to take a minute and share a little bit about the new organization that I'm part of, Common Good Iowa. We are actually merged in August, and we are the former organizations of the Child and Family Policy Center and the Iowa Policy Project, if you're familiar with those two organizations. So we merged in August, and you'll see on the bottom of the screen, we really just expanded the policy areas that we focus on, from clean air and water to well-being of children and families. And as the health policy associate, that's where I focus my time, around well-being of children and families. And that brings me to Medicaid, which is what I spend a lot of my time working on. So I'm going to spend some time today talking about Senate File 389, which is really a direct threat to Medicaid. It actually targets several of our public assistance programs, but I'm going to focus the majority of my time speaking about what this would impact to Medicaid. So what is Senate File 389? It would have the Department of Human Services implement a new eligibility verification system that would apply to several of our public assistance programs, including Medicaid, CHIP, which in Iowa is called Hawkeye, SNAP, and TANF. And the status of this bill is right now it has passed the full Senate, and it has been referred to the House Human Resources Committee and has been assigned a subcommittee of Fry, Brown Powers, and Meyer. So Peggy kind of alluded to this, but I just wanted to connect the dots. Why should mental health advocates care about Medicaid? So Medicaid plays a really important role in covering and financing behavioral health care. It provides coverage to approximately 1 in 5 adults with mental illness. And as Peggy mentioned, funds nearly 3/4 of all adult mental health services here in Iowa. It also plays an important role for kids with behavioral health needs because of the EPS DT training and assessments to kids covered by Medicaid. I mentioned that this bill also targets a couple other public assistance programs. So I briefly wanted to mention a little bit about the connection between SNAP, TANF, and some of those other public assistance programs and behavioral health. I did get a notice that my internet's unstable, so I'm going to turn off my video here just to help things. All right, so why should mental health advocates care about SNAP, TANF? So there's really a strong overlap in people who are qualified for public assistance programs. So if someone qualifies for Medicaid, they also are likely to qualify for SNAP. So the reasons that we talked about mental health and Medicaid being closely linked also apply to some of these other public assistance programs. Furthermore, we've seen research that programs like SNAP that help address food insecurity also may reduce the public health burden of mental illness, which in turn can improve the well-being among vulnerable populations. And losing SNAP, which this bill could lead to, also can affect well-being can also increase. Really important to mental health advocates. So back to Senate File 389. I think that we can all agree that maintaining program integrity in our public assistance programs is a shared goal. I think all of us on the call today really want to make sure that every dollar goes to families who need the help. But this bill is not a common sense approach. What it will do is increase the red tape. It will increase the administrative costs. It really is going to make it harder for Iowans to stay healthy through Medicaid coverage, to put food on their table through SNAP, and to support their families through the Family Investment Program. And I find this is a bill that we've seen pop up several years in a row, but I find this bill especially tone deaf this year, especially heartless when we're in the midst of a pandemic, in the midst of an economic crisis, where people's circumstances are changing from week to week. This bill would be especially heartless to take away some of those critical public assistance programs. So as the title of this presentation suggested, I'm going to walk through the pointless nature of this bill, the pricey cost of this bill, and explain some of the complexities of this bill. So first of all, from our perspective, it's rather pointless. So the Department of Human Services that oversees these programs already verifies identity, income, other eligibility criteria. They already use state and federal databases to make sure that the folks who apply for these programs are in fact eligible. So we already have a robust system in place to verify eligibility. Another wrinkle that makes this bill not very applicable to the time that we're in right now is, I mentioned, obviously we're in a pandemic right now. We're in a public health emergency. And right now, the state is accepting additional federal dollars for our Medicaid program, recognizing that more people will probably qualify for the program and there could be increased costs due to COVID-related healthcare expenses. As a condition of accepting that increased federal assistance, Iowa cannot disenroll anyone on Medicaid right now during the course of the public health emergency. So this bill pretends that if they find someone who does not meet their program criteria, they will kick that person off the program and it will save the state money. But as I just mentioned, right now, we can't kick anyone off of Medicaid. So it really doesn't make sense right now. It's also pricey. In fact, this bill will likely cost the state a lot of money. As I mentioned, it will require the state to develop this complex new develop this system. Either way, it will require a lot of investment in creating a new system. It also runs counter to the principle of good stewardship of taxpayer dollars. So this bill would really impede the existing efforts that the state is undergoing to make eligibility checks more accurate and efficient. So the federal government has already required states to join a database by the end of the year. And this database would do much of what the bill outlines, but the database that the federal government is outlining would already be free of charge to states. So 1 second, I'm gonna pause for a little toddler readjustment. Sorry about that. So instead of spending taxpayer dollars to create this costly system, the state could actually just use the system that the federal government is already providing to states free of charge. So a lot of times you'll hear proponents of this bill talk about, well, we don't want to spend taxpayer dollars covering services for folks who are not eligible for the program. We want to be good stewards of taxpayer dollars. But hopefully, as I just explained, using taxpayer dollars to buy an unnecessary pricey system instead of using a free system from the federal government is not a very good stewardship of taxpayer dollars. The last point about it being pricey is that in some cases, there's really no state savings to be had. It would cost money to bring in less money. So I mentioned I'm going to focus most of my time on Medicaid, but I also wanted to briefly touch on SNAP. If you're familiar with SNAP benefits or food assistance, as it's known in Iowa, is 100% federally funded. So the benefits that come into states, the benefits that go into members' pockets, those are 100% federal dollars. However, the cost of administering the program, that's where the state has to pick up a share of the dollars. So what this bill would do is it would increase the cost of administering the program, which is the state share of the expenses. But the dollars coming in to the state that the federal government is contributing would be reduced if members were cut off the program. So those are federal dollars that would be saved, not state dollars. Just to give you one quick example, Pennsylvania actually tried to implement some of these same provisions a couple years ago. And they found that it cost $3.5 million to administer just one portion of SF 389, the asset test. So they actually repealed it later that same year because they realized it was costing the state a lot of money. Just to drill down a little bit further, I wanted to emphasize how some of the cuts to the SNAP program will ripple out to the local economy. I mentioned that this bill was referred to the House Human Resources Committee. The chair of that committee is a all right, it looks like, can you guys hear me again?
Yes, and Mary Nell, you cut out when you started to talk about the committee chair.
Okay, sorry, thank you. I guess I just lost my internet for a second. Thank you for bearing with me. So I just used kind of a case study using Representative Meyer's district, as she is the chair of the Human Resources Committee. So looking at her 800 people would lose their SNAP benefits. Since each SNAP recipient gets about $200 each month in SNAP benefits, if 1 out of 6 of each of the current SNAP enrollees lose their benefits, that would mean a total loss of $164,000 each month to area grocery stores. We know that SNAP benefits have a ripple effect. So when folks are in the grocery store using their SNAP benefits, the finances that they use extend out into the community. It's said to have about $1.50 in economic benefit. So each dollar of SNAP benefits results in $1.50 in benefits to the community. So if we take that impact. But I just wanted to help unpack how far-reaching this bill's impact will be.
Mary, we just lost you again. You just came back in.
All right, sorry about the unstable internet. I'm just gonna keep moving on here.
And Mary, you're no longer sharing your screen, but I started sharing the PDF that you shared with me, so they can still
Alright.
see that. You need to let me know when to move on to the next
All
slide.
right, thank you, Zach. If you could move on to the next slide, please. Okay, so I want to briefly talk about the complexities of this bill. One of the examples is that I mentioned a new database would have to be created. This database would try and identify discrepancies in the system. So if what someone reported on their application for Medicaid was slightly off from what this new database finds, the family would be notified, and they would have 10 days to get back to the state to address the so found discrepancy. So this is an extra hoop for folks to jump through right now. We know that people's circumstances are changing due to the pandemic. People are being laid off from work, they're joining work again. They might have moved. We also know our US postal system is facing some significant challenges right now. Folks only would have 10 days to get back to the state to address the discrepancy. So this, with the challenges that we're facing with delayed mail, it seems like this is an unfair hoop for folks to jump through. Can you move to the next slide, please, Zach? So that is a little bit of the structure of the bill. I briefly wanted just to take a step back because, as Peggy mentioned, I was on here a couple years ago talking about work requirements. And this bill, Senate File 389, is really framed as a welfare reform bill. So why do we continue to see all these welfare reform bills? Zach, if you could go to the next slide. While Medicaid is a popular program, you'll see this poll of the public found that 74% of Americans had a favorable view of the program. Next slide, please, Zach. The public does have some concerns, and this is what the so-called welfare reform bills are purporting to address. I want to emphasize that none of these concerns are founded, but it's important to know the impetus for this bill when we're trying to fight back on it. So there's a perception of fraud and abuse, that these programs need to be reformed because people are cheating the system. There's a lot of discussion around who deserves to be on this program. We need welfare reform because there's people who are benefiting from these programs that, quote, don't deserve it. And the final concern is that these types of programs encourage dependency, so we need to reform them. I want to reiterate, these concerns are not founded. However, this is some of the sentiments that are felt across the public. Next slide, Zach. And this idea of welfare reform has some surface level appeal. And it's a bit of a challenge for us to fight back because, as I mentioned, it can help put people into two groups, thinking of people who deserve welfare, such as children or people with disabilities, and those who do not deserve it. people who are looking to abuse the system, adults who aren't working, etc. And many people don't care if the quote, undeserving people lose their benefits. So that's one of the barriers that we're up against when we're trying to fight some of the ideology and framing around this bill. Next slide, please. So to further unpack where the public is on these type of bills, I think this is especially true right now during the pandemic. A lot of people have a newfound appreciation for families being one bad accident, one COVID diagnosis, one layoff from the brink. We also know that a lot of jobs that people have today don't have robust benefit packages. They might not offer health insurance. So somebody could be working, but they still have to rely on Medicaid to access their health insurance coverage. And most people do believe that when people are hit by hard times, as a lot of us are right now, they shouldn't go without the basics. They shouldn't go out with health care, without food assistance, without housing. So that just highlights a little bit of the conflicting views of the public. And when we go to the next slide, I want to highlight how we can build off of some of the shared sympathies in the public and stay away from some of those unfounded concerns. So when we talk about why bills like Senate File 389 are bad, it's important to stay grounded in some of our shared values around opportunity, talk about the dignity of Iowans, the importance of ensuring equal access to quality of life, of promoting security, and focusing on the prevention and the preventative nature of some of these public assistance programs. Next slide. So another messaging key when you're talking about this bill is to talk about how this bill would take away some of these critical components. I just mentioned how the majority of the public believes that even in bad times, families should not go without the basic needs. So reiterate that this bill would take away health coverage, take away food assistance, take away family support. So when we talk about these proposals, it's important to talk about who is going to lose, who is going to have these basic assistance programs taken away. It's going to be low-income children. It's going to be working parents and people with disabilities. These are the type of people who would be impacted by this bill. And taking these forms of public assistance, whether it's health insurance or food assistance, that's not going to do anything to make it easier for folks to climb out of hard times, to get back in the workforce if they aren't already, or to help make ends meet. Next slide, please, Zach. So what can you do? It's important when we're combating bills like this to reinforce what Medicaid is. Medicaid is health insurance. It makes it possible for thousands of low-income children and adults to get and stay healthy. It helps make sure that they can work and take care of their families. It also allows Iowans to be able to see a doctor when they're sick, which is especially important right now, to get checkups, to get medications, to be able to go to the hospital without the fear of choosing between their health and groceries or paying for rent. And I think the economic security component of health insurance is critically salient right now to focus on. I think we can all understand the importance of having the security of being able to access healthcare when you need it. Next slide. So I wanted to just reinforce these key bullet points about what Medicaid is. So when you're talking about Medicaid in conversations with legislators, It's important to emphasize, as I said, that it's health insurance. It's important to talk about who it covers, vulnerable low-income populations, that it helps in times of crisis, that it can help improve the economy, that it's critical and actually helps strengthen our rural communities, and it provides that safety net, that temporary help. And I think these bullet points, they're true every day. But if you take a step back and look at some of these pieces, helps in times of crisis, strengthens rural economies. These are especially important as our state struggles to recover from a pandemic and an economic recession. Next slide. So what can you do? I mentioned that this subcommittee has been assigned. I do not believe it has been scheduled yet. And so contacting the members of the subcommittee, which are Representative Fry, Representative Brown Powers, and Representative Meyer. If you just have time to send a couple emails, those are the 3 individuals that I would target. If you have a little bit of more time, or maybe your legislator sits on the House Human Resources Committee, I would suggest reaching out to members and Representative Grassley. So if you move to the next slide, please, Zach. I'm going to reiterate, since I know I went kind of fast, a few of the points that are really helpful in framing why this bill is bad. It passed the Senate, as I mentioned, and so now we have to call on the majority party in the House, who they've seen, hey, my colleagues in the Senate passed this, why shouldn't we? So I particularly framed the bullet points on these slides to help provide cover, to provide an explanation for our Republican, particularly legislators, to not move forward with this bill. So I think it's always important to remind us where we have agreement. So start with where we agree. Maintaining program integrity is a shared goal. We want every dollar to go to families who need the help. That is what this bill pretends to do. But then try and unpack what systems are already in place. The Department of Human Services is already doing much of what this bill outlines. They are already doing everything they can and need to do to verify identity, income, and other eligibility criteria. As I mentioned earlier, I think it's important, particularly for the majority party, to unpack why this program goes against the view of protecting taxpayer dollars. And that is, as I mentioned before, the state has the opportunity to get an eligibility verification system that is free of charge from the federal government. We should not be spending taxpayer dollars to create our own unnecessary system. It would cost money to bring in less money. I talked about the ripple effects to the local economy. We are going to be taking dollars out of our health system. We are going to be increasing uncompensated care in our healthcare providers, clinics, and hospitals. We're going to be taking dollars out of our grocery stores and local communities. So the bottom line is that this bill would hurt Iowa families, it would jeopardize our public health, and it would hurt our local economies. So again, I apologize for going fast. Hopefully that was able to reiterate some of those key points. Can you go to the next slide, Zach? So what questions do we have?
Mary, one question for you that came up in the chat was, does this include Medicaid for kids with special needs?
Yes, this does not have any exemptions. So if you are on Medicaid, it doesn't matter if you're on the medically needy program, this would apply to you.
Perfect, thank you. I don't see any other questions at this time.
All right, well, thank you. And again, I do want to thank all of you for bearing with the internet challenges and the toddler challenges. I do apologize for having to go quickly through these points, but I do believe Peggy has mentioned that the slides will be available, as well as she has talking points that have everything kind of spelled out in bullet form for you. So thank you for your work and time and attention and advocating on this bill, and hopefully those will be helpful resources to you.
Thank you, Mary Nell. Appreciate it. It is time to move on to our last speaker for the day. We're back to Renee, and she's going to be talking about a topic that is very relevant, and it's being debated. It was just debated in the House last Monday, and as I said, passed with only one no vote. And it's now over in the Senate. And Renee has been very involved in this issue. She's very knowledgeable about it. And so we're really thrilled to have her join us again to talk more about telehealth.
Thanks, Peggy. So the presentation we're going to talk about right here is very specific to what is the topics at the State House right now, as far as which the bills are, the bill numbers and all of that. And then I've seen a comment in the chat. I don't know if I can still see chat. We'll figure it out as I go. That was just talking about how to talk about issues in this political climate. And so what most of you don't know, and I'll introduce myself again, is I'm a former state legislator, and I'm a former state Republican legislator. And so a lot of people just assume that issues that are talked about by NAMI Iowa are only concerning one side of the aisle. And I am here to tell you that that is not true. Healthcare should not be a partisan issue. Mental health should not be a partisan issue. It impacts every single family, regardless of our political persuasion. And so the key is to learn the language of the party in which you are speaking to in order to make change. And so when able to change the mental health system to move from 99 counties to regions, that was actually when the Senate Democrats were in charge, the House Republicans were in charge, and we had a Republican governor. So big change is possible. Big change is in any environment is possible. And that requires learning how to speak the language and talking to people. And so Mary Nell's presentation was really good. I know there was some technical glitches, but it was really good in giving you exactly what those two parties are concerned about. And with the Medicaid piece, the biggest issue that I took away from that is that there's a way to do it for free. And why are they wasting taxpayer dollars? And that may not be a particular type of argument that you would be persuaded by, but by Republicans in charge in the State House, that's exactly the message that needs to be talked about. And so we are struggling with some of those particular issues. And I'm going to share with you some of the talking points that matter to the people that are in the majority at the State House right now. And part of being in government relations is I have to not be a party at the moment and work with everybody. And Iowa, up until recently, I still think it is a purple state and we swing. So we have to be able to talk to everybody regardless of who it is. So today we're going to talk about telehealth. And so I can give you some real basic definitions of what it is, what it's not, what a bill in Iowa can impact, what a bill in Iowa cannot impact. And that's going to give you a lot of information because we have a really big misunderstanding of what the Iowa legislature can do regarding this particular topic. So the current code, I've got code numbers in here. You'll have a copy of this slide deck just like anything else. But if you want to go read the actual code of Iowa, what it says, this is the definition of what telehealth is. It means the delivery of healthcare services through the use of interactive audio and visual. So you have to have audio and visual for it to be telehealth. And that is current law. That's not something that's changed. So House File 294 is the bill for telehealth reimbursement parity, where we're talking about getting telehealth for behavioral health paid at 100%, just like you would if you were in an office. That is House File 294. And this is what they're talking about in this bill. So telehealth in this bill means the delivery of healthcare services through the use of real-time interactive audio and video. So that's adding that real-time piece, or other real-time interactive electronic media, regardless of where the healthcare professional and the covered person are located. So some of the big challenges to telehealth is that insurance companies have limited the site of the client or the site of the provider as where you have to be sourced in a certain location in order to be paid. So this bill not only asks for the 100% reimbursement, but it also takes care of some of those details. So we're going to kind of walk through what that means. But here's what telehealth is not. And this is the current Iowa code and in this bill, and this confuses people sometimes. But telehealth does not include the delivery of healthcare services solely through audio only telephone, electronic mail message, or facsimile transmission. Now, there are some big companies at the State House that want to be able to call telehealth information that you would have potentially on your arm through like a Garmin and or through like a heart monitor or things of that nature. And at this point, the definition currently in code is that things that are not real time in the moment where somebody present, that's not telehealth. It may be called something different and maybe should be billable. We can talk about all that, but they're not putting it into the telehealth definition. And so making sure that we're real clear on that. Now, so what else is in this bill? So it talks about changing the definition to include that real-time piece, specifically to limit things like Garmin's and heart monitors and stuff like that. But it also talks about how they shall reimburse for telehealth in person the same as if you're online. And we talked a little bit at the beginning of the day, for those that have been here the whole time, about how the cost is about the same. For myself doing this, I have to make sure I have a HIPAA compliant line, that I am in a controlled setting for confidentiality, that I have locked file cabinets for my files. There were increased costs to adding to telehealth this year. And for many folks, they did not get to get rid of their office during the pandemic. They still paid rent on the office, but had to add a second location. And so there's no cost differential in this. It's not like it costs a lot less to do behavioral health one way or the other. So our position is it should be the same. So the other pieces of this is a condition cannot require an additional healthcare professional to be in the same room with the covered person. That's another way insurance has limited what they will pay for, is they say you have to have like a nurse or somebody in the room with the client in order to be paid for, and they've written that out. This effective date would be upon enactment, meaning as soon as the governor signs it, it would go into effect. And though there's a retroactive applicability, meaning it would go back to January 1st, 2021. During the pandemic, we had kind of a handshake at the end of the last legislative session that insurance companies were going to pay 100% reimbursement during the time of the emergency proclamation. Some of them did, but some of them changed at January 1st and flipped back to the old way. And the old way is about 75% is what most folks are getting paid for doing the same amount of work. So if you're a therapist, and you can get 100% if somebody comes to your office versus 75% if you do it online, you're not going to offer online options very much longer, because that's not financially sound or fiscally smart. And so that's what's important. Now, here's a big piece that I want to make sure people understand and know. What insurance is covered by the bill? Iowa insurance companies, we can only control the ones that the Iowa State Legislature can control. And that's not that many. So these are insurance companies that are regulated by the state in which they are domiciled and are subject to the laws in other states where they do business. So they have to be insurance companies that are domiciled in Iowa. So what does that mean? This is the list of insurance companies that are not covered by any bill that Iowa can pass. So federally regulated plans like Medicare, which is regulated by CMS, or federal employee plans that are regulated by the Office of Personnel Management, or veterans plans like Champus or TRICARE. Those are all through the Defense Health Agency, and then any self-insured insurance plans, which is regulated by ERISA, is the name of that, through the US Department of Labor. And so what needs to happen to have telehealth fixed at the highest level is a federal fix. We need a federal fix so all insurance take care of telehealth. So what does that mean? In Iowa, those are bills, those are plans that Iowa controls. So that could be like our Iowa state plan itself. If you're a member of the state plan, you're a state employee, we can impact that. We can also impact Wellmark, that the Iowa North Dakota Wellmark company is domiciled in Iowa. We can impact that. There are some other smaller companies in Iowa, we can impact them, but we cannot impact the big picture. And this is really important because a lot of people just assume that Iowa can have some sort of jurisdiction over all these plans, and we can't. So it's still, even if telehealth gets fixed in Iowa for these small pieces, we still need to work with our federal NAMI to continue pushing on this at the highest level and making sure that things like Medicaid, Medicare that are currently allowing reimbursement at 100% continue past the pandemic and things of that nature. So we're going to want to work with our federal partners ongoing because we cannot have enough impact to fix this as big of a fix as it needs. So there's also a second bill for audio only. Now, audio only, as you heard in the original bill, the definition for telehealth was audio plus visual. But during the pandemic, we were using audio only. So meaning people could use a telephone call and they were counting that as a session for telehealth. Now, what you need to know about that is they pulled this out in a separate bill. And this bill has actually made a lot more progress through the House and the Senate because it's just this small piece than the other bill has. But what this bill will do is allow that audio only telehealth or telemedicine by healthcare professionals for any type of telehealth medicine that's going to be rural and for any organization that is not prohibited by law. So let's talk about the breakdown of what that means. So it's going to require that the board licenses or certifies that whoever certifies you to adopt new rules to allow audio only in two cases. If there's no law to the contrary that says you can't do it, or if it meets the same standards of care and professional ethics are required. So if you meet the standards of care and there's no law prohibiting you from it, this is a fix that will happen in rule. Now, there's a lot of questions that typically come in at this point about why is audio only not in telehealth? Because if it was, it is illegal by some types of telehealth to do audio only by law. It's contrary to the law. And so that would make that other bill not able to be passable because it wouldn't work. And by doing it this way, audio only covers every type of healthcare. If you're allowed to do it, all it says is if you're allowed to do it, then you can do it. So the bill has been pulled apart separately so that audio only is addressed. Now this bill has passed the House. It's moving through the Senate. So we very well could get this one moving. This one's moving the best of the two all by itself without a challenge. Now there's a third bill that includes mental health only. It's called House File 706, but it is for all telehealth to be 100% equitable reimbursement. So that would be every type of telehealth that you can think of. And that's got an even steeper uphill climb. Mental health was not taken out of it because they didn't know how to do that in a way that wasn't punitive, but it's left in there. And that particular bill really don't think that it's going to move very far, very fast. So we haven't really included much of that in here today. So what do we do when we're talking about this particular bill? So I'm going to back up a couple slides here when we're talking about what is in House File 294. Now, one of the big pieces that is making a difference, and this is the conversation about what you can say to people if telehealth matters to you, when telehealth doesn't get paid for, and I can give you examples. So we have a few companies in our state that helps get telehealth psychiatry into regions. So it could be in jails or hospitals or different places where you might not have a psychiatrist located there, but you're able to get psychiatric services through telehealth. And what is happening now is that if they don't get paid for by the insurance companies, the regions are stuck paying for it because somebody's going to pay a provider. So if for some reason telehealth is done and it's not getting paid for, regions may end up picking that up, and they get to choose if they do or they don't, and they can have that conversation. But one of the pieces of language that is working at the State House is that by not paying for this and having insurance pay for this, that can fall back on regions, and regions are right now 100% funded by property taxes. And all three chambers that are there, your Senate, your House, and your governor's office, doesn't really want to raise property taxes. So the message talking about how this is impacted upon regions and the regional impact actually is making some conversations that stick. Now, one of the arguments that you're going to hear, though, against this bill is that they want to let the markets work and they don't want to dictate to insurance what could happen. Insurance is fighting really hard to say that by making them pay 100%, that somehow it's going to lower the standard of care, those types of things. And so that's just fear tactics, right? And so there's a thing about, well, insurance premiums can go up. And insurance says that every time any mandate to any kind of insurance is ever discussed. And that's true. Premiums can go up. But my argument for that is in this season is we're seeing the value of telehealth right now. More people are actually not canceling their appointments. More people are staying connected via telehealth. More people are actually following through on their appointments. And on the big picture, that's saving the healthcare system. It is money. It's just saving money. Because if you keep people out of crisis and you allow them to have access to the ongoing support that they need, and they're not going back into the emergency room in crisis on a regular basis, that saves the overall system money. And so, yes, the number of people have increased that are using telehealth right now, and that has been a challenge for the insurance companies, but that's also the number that has decreased of people showing up at the offices. And for those that weren't with us earlier, one of the concerns that we have, and another way to discuss this topic, is workforce. You've got a lot of older folks that are in the mental health field that are not able to go back into their offices due to their own health issues. And they're going to either retire or stop working or do something different if they're not able to make this financially work. And so this is a workforce issue. It's a property tax issue. There's a couple of different ways you can discuss it. But it's really important when you think about telehealth, just because it's access. Now, we had challenges with Mary Nell a while ago, right, with coverage. And somebody put in the comments that that shows the challenges with broadband coverage, which it totally does. And so you've got a lot of issues here that we can avoid if we can get this paid for. Because I'm telling you, providers are not going to be able to do it if they can't get paid. And so it's not because they don't want to, but you can't go to the point of getting paid 75%. So any behavioral health provider is impacted by this bill, and it should be somebody that you talk to about the issue. It needs to be clear that we need this so that it keeps the insurance company paying for their portion, so it doesn't fall back to regions to do it. And we need it to sustain our workforce to make sure that we have access for all through our state. One more fact I will tell you when you're thinking about this argument is that there's a weekly, I always forget the name of it, but there's a weekly survey that we do with the CDC that tracks people's anxiety and depression week in and week out. Before the pandemic last year, we ran about 11% of people that would say that they were anxious or depressed. At the height last summer, we were up to almost 50% of Iowans. And now we're hovering around 35% of Iowans. That's 1 in 3 people are dealing with clinical anxiety, depression. So the need for telehealth has never been greater. And so it would be a slap in the face to providers to not allow them to be able to get paid for the work that they're doing. And many folks are taking more time to do more of this work and being able to, get to more clients, and have been working really very hard. And so we want to make sure that they are reimbursed fairly for their work. Another question I have here is about, if the internet doesn't work that day, over the phone. In the pandemic, some have been able to be paid for audio only, but that's going away after the pandemic. And then the CDC tracks that by an ongoing survey that they do, the ProQual that they do week in and week out. And you can actually see the CDC, it's a tracking device. And so Iowa now is standing right at 35% as of the last week, which was tracked the first week of March. Any other questions before I go to what we're supposed to do next? I don't know how you get involved in the tracking. You would have to go to the CDC website to find that. So the next steps, somebody talking?
This is Nina. I do
Nina.
see several in the Q&A. Did you
Okay.
want to wait on those, or did you want to take those now?
I will take them right after this slide.
Okay.
Thank you. So the next steps, these are the bill numbers if you are interested in helping pass. House File 294 is that mental health reimbursement parity. This one has passed committee in the House, but it hasn't even passed the House floor debate. So we've been asked to talk to leadership in the House regarding House File 294. Again, that leadership in the House is Representative Grassley, Representative Winshuttle, and Representative Pritchard in the House. The House File 88, I think probably has a new number as of today because it just started moving in the Senate. That's your audio only, and that one is moving. And so that one is going to be good for the different types of providers that can do audio. It will be allowed if that bill passes. So if you're a fan of audio only, because video is a challenge for you, you're going to want to track House File 88 and through the next number that it becomes. And then third and finally, we have to advocate with our federal partners. If you really want insurance that pays equitably for telehealth and you want more access to telehealth, the federal government's going to have to help fix this, because we can't just continue to have piecemeal products where one insurance company like a Wellmark, we can impact some of their plans, but all of their self-funded plans still won't be impacted. So what that means is a provider has to know what type of plan each individual person has in order to determine if they're going to get paid or not. And that is a huge pain in the butt. So we want to make sure that we continue to work at the federal level in order to talk about that. All right, so in the Q&A, we've got a couple of more questions. Let's see if I can get through these. How to get more psychologists in the Des Moines area. That is not just a Des Moines problem. That's a Midwest problem. We don't have mountains. We don't have oceans. And telehealth is going to be our best bet to get people here, because you can't make people move to the Midwest. All states around us are short also. And so the best way to fight to get more expertise and to get more specialists in the area is to fight for telehealth, because we can get telehealth from anywhere and actually be able to have access to specialties that we don't have in our area. So that's one thing. That's why telehealth is such an important issue, is because we are not going to be able to manufacture more people. Now, on a different side, a different note, we are working to build residencies. We are doing all those other things that you can be trying to do to build workforce, to try to get more people here, but we are just short, and everywhere around us is too. And so that is going to be a collective problem over time. So telehealth is the fastest answer to get there. Rural access to mental health care, same thing. It's going to help by making sure that you have access to people. The specialists you can get from anywhere, and that will be why you need to continue to work on this bill. This bill is the fastest answer to getting you access, no matter where you live. Is telehealth, and making sure that it's reimbursed at a competitive rate, because there's nobody going to do this at 75% of what they get paid in office, because why would you? Nobody else gets paid 75% to do stuff sometimes, so that's not going to work. So we're going to have to continue to work on this issue. Change definition of telehealth. I don't know what Medicaid has done at the federal level. That's possible, but I don't know. So it wouldn't impact us until we change our state law. So that's why that's needed. And then telehealth is gaining traction with Talkspace and other therapy online apps and programs. How are they able to bill? Well, again, it just totally depends on your insurance company. So if you are a self-funded plan, you might have one kind of plan. If you're a veteran, you may have a different kind of plan. So they're having to bill differently to each individual person that they work with, their different insurance company. And so it's a lot of work for providers. If you want to help multiply the time that psychiatrists and therapists have to work with people, simplifying this would be a massive win, because right now they're spending so much time billing and then getting claims denied and rebilling that takes on people and manpower and staff time where they could be working directly with people. And so anything we can do like this to make the system cleaner, the system easier to maneuver for therapists and psychologists and psychiatrists, the better off we're going to be. What's the House number again that coincides with Senate File 389? I don't know what Senate File 389 is. Hold on. Senate File 389.
That's the one that Mary Nell was talking about in connection to Medicaid.
Actually, okay, but that's not I don't think that's the right bill number, because it doesn't come up.
And I'll just, there is no equivalent House file for the Medicaid bill. It's just a Senate, it's just a Senate file.
Right.
At
I don't
this
think it's
point,
Senate File 389. I don't think that's the right number, because it doesn't, nothing comes up.
what I was going to say is at this point in the legislative session, we've already been through the first funnel, and we're coming up on the second funnel, which means that a lot of bills are either, in fact, most bills are now either a Senate file or a House file. There's not one on each side.
No, and yeah, so there's no, this bill has already gone all the way through the Senate. So Senate File 389 is all the way through the Senate. It's sitting in a subcommittee in the House in Human Resources. Yep.
I was also going to jump in, Renee, and say that that with telehealth, I want to make sure we make the point that Medicare and Medicaid are both paying 100% parity for telehealth, and the federal government and the state government has made the commitment to continue that. So it's not a concern or an issue with either Medicare or Medicaid at this point. It's really just the private insurers. I want to make sure people understand that. And in terms of providers, we did a day-long session with the University of Iowa and Iowa State back in December for farmers and peer support. And we had a working farmer who literally called us from his tractor cab while doing work. And he said that telehealth has made such a difference for a lot of farmers specifically, because instead of spending an entire day driving to an appointment possibly 2 or 3 hours away, doing the appointment and then driving back home again, they're able to do it from the cab of their tractor or from their pickup or from home. And that has made a huge difference. So it's allowing the limited providers that we do have, clinicians who are mostly in metro areas, in urban areas, to have a more efficient and wider spread throughout our state. And why wouldn't we want to do that? Just wanted to make that point. Do we have any other questions? Nope. Or
not that I see?
Okay.
It is time for your action steps for tomorrow. It is. You made it to the end.
Okay. Well, thanks, Renee, and feel free to jump in here too. So just a review of how we hope that you will engage. If you remember back to our session toward the beginning of the day with Renee and Rachel, we had several different strategies that you can use to reach out to your legislator. Email, of course, although they are getting a lot of emails. And I just want to reiterate, as somebody brought up earlier, what if I don't hear back from my legislator? Well, what Renee said is that means you haven't contacted them enough, which I had to kind of chuckle at, but that's true. So if you don't get a response to your email, I would suggest that you follow up with a phone call and try and get your legislator's cell phone number so you can reach them that way. And then a lot of them communicate by text, and that's actually their preferred method. So take the time to find out how your legislator likes to be contacted and will respond, and then communicate with them that way. But it could be email, it could be phone, it could be texting. Well, and then there's always the forums, which we are working on connecting you with. Some are virtual, some are in person, and legislators are continuing to offer those. And those are great because that gives you a chance to be in a setting with other people from the district to talk with your legislators. And usually there's more than one who do them together. And then they can hear about, and often when you bring up an issue in a forum, you're going to find that other people will chime in and say, yeah, I care about that too. And you'll often start a dialogue, which is really great because that is going to cement that in the minds of the legislators more than just a one-off. So I really encourage all of you to try to engage in at least one forum during the legislative session, whether that's in person or virtual. We are always available to help. So if you have questions, you can email us at info@namiiowa.org, and we will make sure that the right person sees your question and addresses it. All of you now are signed up for our weekly legislative update, which we get out each Friday during the session. And then when they're not in session, we put it out monthly. And it's just the latest on what is happening in the legislature with different issues and different bills. And so watch for that. It might go to your spam folder. I always tell people, look in your spam folder if you're missing it, because sometimes that's where it ends up. But it's coming from NAMI Iowa, and it's a pretty good source of information about mental health related legislation each week. But if it's what you're concerned about isn't in there, let us know, and we'll track it down and get back to you. We have a great lobbying team. Renee is the lead person, but we have three others from PolicyWorks, John Cacciatore, Lon Anderson, and Christopher Rance. And they are up at the Capitol most every day watching and representing us. And they can track things down, and they keep us informed about what's happening.
Peggy, I wanted to just share. So the Iowa DD Council, somebody earlier today said that legislators' addresses are not somewhere they were looking for them, but it's public information. Mm-hmm. So InfoNet, the Iowa DD Council, put out this massively large book with everybody's photo in it and everybody's home addresses and the committees they serve in and all of that. So that's one resource where every bit of information is, if you didn't find what you were looking for. But second is the official directory at the State House. And this is available for free at the Capitol. You have to go to the Capitol to get one. Nobody's going to mail you one. But in it, it's got who's who, the staff names, the secretaries of each legislator, all of those kinds of things. And they're free to you if you want one. You can pick up two when you're there in the building. and it has all of that information. So there's ways to get the directories. Those are just two. I know the banks put out directories. There's a plethora of directories out there. And so if you need contact information, use that info at NAMI, and they will make sure that you get the information that you're looking for, because it is public information. So you're not doing anything illegal using somebody's cell phone. It's public. My cell phone number is still the number I had when I was a legislator, and it still gets called by random people. And it's the way it is. It's public. And so, you know, that's part of the gig. So it's an okay thing to do that. So if you are looking for something and you need to talk to somebody specific, use that info at NAMI, and then they'll make sure they get you what you need for contact.
Renee, can you show that first resource again? I didn't have your video going.
It is the Iowa DD Council, Iowa InfoNet. They got a grant by somebody and put together this massive big book, and it's free. They mailed it to me. I didn't pay for it. And it's www.infonetiowa.org.
It's not NAMI, just to clarify.
It's not NAMI, but
No.
NAMI can use it for good.
Well, and also there's a legislative website, which is a wealth of information. It has all the information about all the legislators, which committees they serve on. You can click on their name and get more information about them specifically. Their pictures are on there, as well as you can type in any bill number on that website and the bill will pop up. And it will show you everything about the history, how lobbyists have registered on it, what the status of it is, everything. It's really a great source of information. So recording of today's session will be added to the webpage within a few hours. Slide decks are available now. So any of the slide decks that were presented today are on the website. You can get them. Just supposed to remind you to complete your evaluation forms and your legislator contact forms. Please fill out a legislator contact form for each legislator that you talk to. That's how we are able to track who has talked to who and what they said. And every year we get some valuable information from those things that we did not know. So the more specific you can be, the better. Especially if a legislator wants information and you're not able to provide that to them, we want to make sure that we learn about it so that we can get it to them. We don't want to drop the ball on that. Reminder to follow us on Facebook. We have nearly 7,000 followers and we post at least daily. It's a source of a lot of really great information. And I want to thank all of our speakers. It was a great day full of information, maybe too much for people, but now you have a chance to, if you want to, watch the recording and look at the slides again and take some time to process the information. But if you have any questions, please feel free to reach out again. You can get us through our website, namiiowa.org, info@NAMI Iowa. So Renee, any closing thoughts?
Nope. But if any of you decide, well, I guess if you decide to take action on any of these issues, it's only going to be helpful. You can't really mess this up. You can't do it wrong. They need to hear about mental health. And if they don't understand what you're talking about, hopefully they'll reach out to learn more. So please don't be afraid of advocating. You can only tell your story and they won't know it if you don't tell it. And so the only way to make change is for you to speak out. And that's the only way we've made the changes we have over the years is by advocates like you sharing. And so it's really important if these big topics today impact you, you've got to be the one to share, because you can't just assume somebody else is going to, and then the bill doesn't pass. And then you're sad next year that you didn't get what you needed. So thanks for coming, but you need to step up and do our day of action. Tomorrow is going to be a big day.
Yeah, so we can't be there in person, but we can be there through all these other ways, all these other strategies, and we can make our voice heard.
That's right.
And so we'll hope that you all will take advantage of that. And like I said, if you don't already, and you know, we do have quite a few new legislators, right, Renee?
We do. a
We
lot.
just had an election. So we have quite a few new legislators. And I know I've had some people reach out to me and say, you know, I don't even know my new legislator. Well, this is a great opportunity to get to know your new legislator because they're going to be there for at least 2 years. If they're a new senator, they'll be there for 4 years. So it's really important that you get to know them and they get to know you. They know that you are a mental health advocate from their region. You build that relationship, then they are going to start to come to you when they have questions. They will start reaching out to you. Like, what do you think of this bill? Do you like this? Is this going to work? And again, you don't have to be an expert. Don't let that intimidate you. If you ever need any information or help with anything, just reach out to us and we're here to help. But building those relationships is key because that is how, honestly, I can't tell you how many times I've heard a legislator say, like, one person who they really know well and they have a connection with reaches out to them on one issue. That can be the motivation to get a bill filed or to vote a certain way. It literally can be one person, one voice, and you never know, you might be that person. So thank you all for joining. We really appreciate it. And we look forward to seeing you and advocate and engage. And hopefully we will all be able to be together next year.